Assalamu alaikum. Today we are going to discuss about the laryngeal apparatus. On the laryngeal apparatus, if we look at it from the anterior side, we can see that this is the hyoid bone, a membrane which connects the hyoid to the thyroid cartilage, the thyrohyoid membrane. This all of it is the thyroid cartilage, and beneath it here, this is the cricoid cartilage. Anterior to the laryngeal apparatus, there is a gland which is called the thyroid gland. So now in detail, if we look at the hyoid bone, we can see that it has a body and an inferior horn and a lesser horn and a greater horn. So the hyoid bone has a greater horn, a lesser horn, and the body. Inferior to it, there is the thyrohyoid membrane. If we look at the thyroid cartilage, what we can see is that there is an anterior prominence. This anterior prominence is called the laryngeal prominence. From the laryngeal prominence, there extend the lamina of the thyroid gland. This is the lamina of thyroid gland, which going posteriorly makes a superior horn and an inferior horn. So the thyroid cartilage has a superior horn, inferior horn, anterior laryngeal prominence, and the thyroid lamina. There are two structures that pierce the thyrohyoid membrane laterally. The internal laryngeal nerve here, this is the internal laryngeal nerve, and the superior laryngeal artery. There is a muscle which goes from the thyroid towards the hyoid. This is the thyrohyoid muscle. Moving inferiorly, on this side you can also see the internal laryngeal nerve and the superior laryngeal artery, thyrohyoid muscle as well. Moving inferiorly, if we look at the inferior part of the thyroid cartilage, we have this cricoid cartilage. This cricoid cartilage, if we remove this part, we can see it is attached to the thyroid by another membrane, the cricothyroid membrane. This is the cricothyroid membrane, and this is the cricoid cartilage, which has a signet ring appearance, with its arch anteriorly and its body posteriorly, which is the bigger part. It is present posteriorly, and the arch of cricoid is present anteriorly. Joining the cricoid with the thyroid cartilage is the cricothyroid muscle, and the inferior horn forms the joint with the cricoid cartilage. This is the cricothyroid joint. Alright. If we move posterior to it, this is the first inferior to it, this is the first tracheal ring, second, third, fourth, fifth, and sixth tracheal rings. Between them are the tracheal ligaments. The other cartilages which are present in this laryngeal apparatus are paired cartilages, arytenoid, corniculate, and cuneiform. The arytenoid cartilage is not visible in this model. We can see the corniculate and the cuneiform cartilage. The muscles which are involved with the laryngeal apparatus are the two extrinsics which we talked about, the thyrohyoid muscle and the cricothyroid muscle, which tenses the vocal cords by moving this whole apparatus anteriorly. There is another cartilage which is the epiglottic cartilage. This epiglottic cartilage is the one which closes and opens the laryngeal inlet. This is the laryngeal inlet, and this epiglottic cartilage opens and closes this laryngeal inlet. So this epiglottic cartilage is attached to the hyoid cartilage with the hyoepiglottic ligament, and it is attached to the thyroid cartilage by the thyroepiglottic ligament. After that, we see that there are some muscles. These muscles are, this is the posterior cricoarytenoid, as the arytenoids are present over here and they move the vocal cords. This is the posterior cricoarytenoid. This is the lateral cricoarytenoid. This whole mass is of different muscles which are going to continue into the quadrangular membrane. These are the oblique arytenoids, and the fibers which have the horizontal direction, these are the transverse arytenoid muscles. If we look at the nerves, what we can see is on the trachea, on the posterior side of trachea, the recurrent laryngeal nerve runs after looping through from the arch of aorta and the subclavian artery. These move upwards on the posterior side of the trachea. As it reaches the laryngeal apparatus, that is the cricoid cartilage, this nerve changes its name and becomes the inferior laryngeal nerve. So if there is a spot here, this is the recurrent laryngeal nerve, and moving upward it becomes the inferior laryngeal nerve, the same nerve with a different name. So after that, what we can see is these things. If we can imagine that the root of the tongue is present over here, and from the tongue towards the epiglottis there are some projections or folds. These are the glossoepiglottic folds. This is the median and this is the lateral glossoepiglottic fold, and between them is vallicula, a depression between the two glossoepiglottic folds. Here there is another depression which is present between the quadrangular membrane. This is laryngeal inlet, is formed by the quadrangular membrane which extends from the epiglottis towards the arytenoids. Alright, so this is the quadrangular membrane and this was the thyrohyoid membrane which is covered by the mucosa, and between these two there is a fossa which is called the piriform fossa or the smuggler's fossa. Alright, coming towards the nerve supply, how it supplies is that the superior laryngeal nerve here above the laryngeal apparatus, the superior laryngeal nerve is divided into an internal and an external branch. The external branch supplies only one muscle, which is the cricothyroid muscle. The internal goes and pierces the thyrohyoid membrane and is going to supply the mucosa above the vocal cords. The recurrent laryngeal nerve, which is the continuation of the recurrent laryngeal nerve, inferior laryngeal nerve, it is going to supply all the muscles and the mucosa below the vocal cords. If we look at the internal part of the larynx, what we have is this is the laryngeal inlet. This is the vestibular fold, which is the posterior free part of the quadrangular membrane. This is ventricles between the vestibular and the vocal fold, and this is the vocal fold, which is formed by the cricothyroid ligament, and it has a muscle attached to it, which is the vocalis muscle.